Assessment is a dynamic and iterative process that involves more than simply administering tests. It is a comprehensive approach to gathering information about an individual's abilities, strengths, weakness, and progress. This process typically involves several key steps. Subsequent to the selection of the instruments or procedures to be employed, the formal assessment will begin. After the assessment, the assessor writes a report of findings that is designed to answer the referral question. More feedback sessions with the assessee and or interested third parties, such as the assessee's parents and the referring professionals, may also be scheduled. Different assessors may approach the assessment task in different ways. Some assessors approach the assessment with minimal input from assessees themselves. Other assessors view the process of assessment as more of a collaboration between assessor and the assessee. The collaborative psychological assessment. The assessor and assessee may work as partners from initial contact through final feedback. Another variety of collaborative assessment may include an element of therapy as a part of the process. Stephen Pinn and his colleague have described a collaborative approach to assessment called therapeutic psychological assessment. Here, therapeutic self discovery and new understandings are encouraged throughout the assessment process. Another approach to assessment that seems to have picked up momentum in recent years, most notably in educational setting, is referred to as a dynamic assessment, suggests to some a psychodynamic or psychoanalytic approach to assessment. As used in this context, it refers to the iterative, changing, or psychoanalytic varying nature of the assessment. In general, dynamic assessment refers to iterative approach to psychological assessment that usually follows a model of evaluation, interventions of scoring, and evaluation. The dynamic assessment is most typically employed in educational setting, although it is employed in correlation, cooperative, correctional, correctional, cooperative, neuropsychological, clinical, and most any other settings of assessment. So the process typically involves several key aspects also. Define the purpose and the scope. Clearly articulate the goals. What specific goal information do we hope to gain from the assessment? What decision will be made based on the result? Determine the scope of the assessment. What areas will be assessed? What specific skills or knowledge or abilities or interests? And identify the target population to whom it will be assessed or either there any specific characteristics or needs to be considered. Second one, selecting appropriate assessment methods. Consider various methods. Define the purpose and scope. So interventions between evaluations, sometimes even between individual questions posed or task given, might take many different forms depending upon the purpose of dynamic assessment. The purpose of the intervention may be to provide assistance with mastering the task at hand. Progress in mastering the same or similar task is then measured. In essence, dynamic assessment provides a means for evaluating how the assessee process or benefits from some type of interventions, feedbacks, hints, instructions, therapies, etc. during the course of evaluation. In some educational contexts, dynamic assessment may be viewed in a way of measuring not just learning but also called learning potential, learning how to learn the skills. So, selecting appropriate assessment method is very important. Consider various methods, choose a combination of methods that best suits the purpose and scope of assessment. The observational method is one of the systematic observations of behavior and performance in natural settings. Interviews, structured or unstructured, conversations to gather information about individuals' thoughts. So, considering by following the steps and considering these key considerations, you can conduct effective assessment that provide valuable insights to individuals' abilities, strengths, and weak